Welcome to our video on the 7 signs and symptoms of lung cancer you should know. Did you know that lung cancer is the second most common cancer worldwide and the leading cause of cancer-related deaths? Every year, it claims more lives than breast, colon, and prostate cancers combined. The scariest part is that many people don't realize they have it until it's too late, but don't worry, spotting the signs early can save lives. And in this video, we'll uncover the 7 warning signs that could mean your lungs are in danger. Some of these symptoms may seem harmless at first, but ignoring them could be a deadly mistake. Starting off our list at number 7 is a persistent cough. A cough that sticks around for weeks or even months, or one that gets worse over time, isn't something to ignore. While many coughs are caused by common illnesses like colds or allergies, a lingering cough could be your body's way of signaling something more serious, like lung cancer. About 50 to 70% of people diagnosed with lung cancer report a persistent cough as one of their first symptoms. If the cough produces blood or thick, unusual mucus, it's even more concerning and should be checked immediately. What makes this symptom tricky is that older adults, especially smokers or former smokers, often dismiss it as just part of aging or chronic bronchitis. But if it doesn't improve, it's crucial to see a doctor. Remember, a persistent cough isn't just a nuisance. It could be your lungs trying to tell you something's wrong. Don't wait too long to get it checked out. Early detection can make all the difference. Next on our countdown is a symptom that often goes unnoticed until it becomes severe. At number 6, we have shortness of breath. If you find yourself getting winded while doing simple tasks like climbing stairs, walking, or even just sitting still, it could be more than just aging or being out of shape. This kind of breathlessness might signal lung problems, including lung cancer. Studies show that about 20 to 30% of people with early lung cancer experience shortness of breath. This happens because a tumor can block airways, press on surrounding structures, or cause fluid buildup around the lungs, making it harder to breathe. For older adults, especially those with a history of smoking or exposure to harmful substances like asbestos, shortness of breath can be a red flag. Don't brush it off as just getting older. If you're struggling to catch your breath more often than usual, it's time to see a doctor. At number 5, we have chest pain. Chest pain linked to lung cancer often feels different from the occasional aches you might get from pulling a muscle or a bout of indigestion. This pain can be sharp, dull, or constant, and it often gets worse when you take a deep breath, cough, or even laugh. It can also radiate to your back or shoulders, making it easy to misinterpret as something else, like a heart issue or arthritis. Here's the science behind it. Tumors in the lungs can press against surrounding nerves, blood vessels, or even the chest wall, causing discomfort or pain. In some cases, the tumor may cause inflammation in the lining of the lungs, known as pleuritis, which can lead to sharp pain every time you breathe in. However, this pain is often dismissed as something less serious, especially in older adults, smokers, or those with a history of chronic conditions like COPD. If you notice persistent or worsening chest pain, especially if it's paired with other symptoms like shortness of breath or a cough, don't ignore it. Getting it checked could make all the difference in catching lung cancer early when it's more treatable. Your body knows how to send signals, so don't miss the message. At number 4, we have unexplained weight loss. A warning sign that often flies under the radar, but can indicate something serious like cancer. If you're losing weight without making changes to your diet or activity level, it could be a sign that your body is fighting something big. Lung cancer in particular can cause weight loss by interfering with your body's ability to process nutrients and maintain energy. Here's how it happens. Lung cancer cells use up a lot of your body's energy as they grow and spread. They can also release substances that change how your body breaks down food, leading to rapid weight loss. In fact, studies show that 60 to 80% of people with cancer experience significant weight loss at some point, often as one of the first noticeable symptoms. This kind of weight loss is usually more than just a few pounds. So if you've lost 10 pounds or more without trying over a few months, it's worth paying attention. For older adults, it's especially important to take this seriously, as many might chalk it up to aging or stress when it could be a signal of something much bigger. Unexplained weight loss is a sign that your body might be struggling. Next on our countdown is a symptom that's often brushed aside, but can be a major clue that something isn't right. At number 3, we have fatigue. This isn't your usual tiredness after a long day or a bad night's sleep. Cancer-related fatigue feels different. It's a deep, ongoing exhaustion that doesn't go away even after resting. You might wake up feeling just as tired as when you went to bed, and simple tasks like getting dressed or walking up the stairs can feel like running a marathon. Lung cancer can sap your energy in several ways. The body diverts energy to fight the disease, and tumors can release substances that alter your metabolism and cause inflammation. Additionally, lung cancer can lower oxygen levels in your blood, making you feel more drained. Fatigue is actually one of the most common symptoms of lung cancer, with 80 to 100% of patients reporting it at some point during their illness. Yet, it's often ignored because it's so easy to blame on aging, stress, or other health conditions. At number 2, we have hoarseness or voice changes. If your voice sounds raspy, strained, or different from usual, and it doesn't improve after a few weeks, it might not just be a cold or overuse. Persistent changes in your voice could be caused by a tumor pressing on the nerves that control your vocal cords, specifically the recurrent laryngeal nerve. When this nerve is affected, it can alter the way your vocal cords function, leading to a hoarse or weakened voice. Voice changes might seem harmless at first, but they can be a key indicator of lung cancer, especially if they're accompanied by other symptoms like a persistent cough or chest pain. According to research, voice changes are reported in 2 to 18% of lung cancer patients, and they're often linked to cancers in the upper part of the lungs near the throat or major airways. For older adults, hoarseness can sometimes be dismissed as a result of aging, acid reflux, or other common conditions. However, if the hoarseness doesn't go away or keeps coming back, it's crucial to get it checked by a healthcare provider. Your voice is a powerful tool, and changes to it might be your body's way of signaling something deeper. Don't ignore this subtle but important symptom. Finally, at number 1, we have frequent respiratory infections, a symptom that might indicate more than just a weak immune system. If you find yourself dealing with repeated bouts of pneumonia, bronchitis, or other lung infections, it could be a sign of lung cancer. Tumors in the lungs can block airways, making it harder for your body to clear out mucus and germs. This creates the perfect environment for infections to thrive. These infections can keep coming back, even after treatment, or they may take longer than usual to clear up. For older adults, repeated infections are often brushed off as a natural part of aging or seasonal illness. However, if they occur more frequently than before, or seem unusually severe, it's a red flag worth investigating. And there you have it, our countdown of the 7 signs and symptoms of lung cancer: frequent respiratory infections, hoarseness or voice changes, fatigue, unexplained weight loss, chest pain, shortness of breath, and persistent cough. These symptoms might seem small on their own, but if you notice any of these, don't ignore them. Talk to your doctor right away. Early detection can save lives. If you found this video helpful, don't forget to like and subscribe to our channel for more health tips and information. If you'd like to support our work, consider sending a super thanks or checking out our merchandise. Your support helps us create more valuable content like this. Now, we want to hear from you. Did any of these signs surprise you? Or do you know someone who has experienced these symptoms? Share your thoughts and stories in the comments below. Your experience might help someone else. Thanks for watching, and we'll see you in the next video.